Thank you, Emily, and hello, everyone. Thank you very much for joining me and my colleague Irving Stackpople as we tackle this challenging topic. And before we dive into the content, I would like to set the stage for it and just say that what we plan to do today is to, first of all, not engage in political discussions. We don't care whether you are a fan of President Trump or not. What we would do want to do is to take what we have learned from his first administration, from the language and speeches that he's given during his candidacy, and what has transpired within the first couple days of his administration, to really look at the impact of all of those factors on medical tourism, and whether that is for those of you who are looking to bring more US patients to your destinations, or whether you have other agendas that you would like to know about, how well your destination might be received by a US audience and so on. So that's really our intention. So Irving, the next slide, please. So we are going to cover these 4 areas of concern of travel policy and regulations, the economy, and insurance in a somewhat flexible format. We do have a limited number of slides, but we know everything is changing very quickly. So there'll be an interchange between the two of us, and we plan to leave plenty of time for your questions. So to begin with, first of all, for those of you looking to perhaps recruit Americans to come to your destinations, first of all, we need to look at the ability of people to travel. So a little bit about the US market that some people may not realize, just to put it in context. So as of 2023, approximately 150 million US passports were issued. And that's an approximate number because sometimes there are passports that expire during a year. Sometimes some people hold more than one valid US passport. And that number of 150 million refers to any American citizen. It could be from a baby all the way to the age of 110. So in contrast to that, looking at Canada, about 70% of all Canadians hold a valid passport. So that comes down to 26.9 million passports for a population of 41.5 million people. So that's nice information, but what does that mean in terms of trying to reach markets that you may be looking for, whether it's a US market or Canadian market? So just simply speaking, there are, could you go back please, Irving? There are more people with passports in the United States, but they are spread out over the entire country. While in Canada, there's a smaller number of passports, but people tend to be in discrete metropolitan areas. So for your marketing budget, you can find that you will spend a lot of money in the United States trying to reach the people you want to reach, while your marketing dollars probably go farther in Canada. So that means you need a really good strategic plan, and you need very solid market research for either Americans or Canadians for your marketing dollars to be spent well. Next slide, Irving, please. So not only do Americans need the ability to travel, which is referenced by having a passport, it's how willing are they to travel internationally. A lot of Americans are quite parochial. Many people never leave the city or the town or the region where they were born. But according to this data from the US Travel Association, somewhere between 40 to 45% of the Americans surveyed expressed interest in taking an international trip either in 2024 or this year, 2025. and they have couched their willingness to travel by whether or not the destinations offer interesting cultural experiences. It's of course impacted by how much money people have to spend on a holiday or on traveling. Maybe it's somebody from Florida going to the Bahamas for 3 days, or somebody from California who's going to go to Thailand and spend a month there. And there are also travel restrictions that may be in place. It could be people who have some sort of disability, who might find one destination more appealing than another. Or other restrictions in terms of visa availability. And the big question is, of the 43% of people who, Americans who have a valid US passport, are they the same 43% of people who responded to this survey? We simply can't know that. So next slide, please, Irving. And then, of course, there are countries where Americans cannot go. So the US government may put restrictions in place, or other countries may restrict Americans coming to their country. So the one that I find very interesting on this map is Russia. As you might imagine, I get quite a lot in my feed every day, every week about the latest hot medical tourism destination. And the one that I got this week was about Russia as the next new medical tourism destination. So apparently not for Americans, maybe for other people, but I think it's quite interesting that everyone is now the hot medical tourism destination. Next slide, please, Irving. So we have the ability to travel, we have willingness to travel, we have places we can't travel. So this is moving into the territory of President Trump and some of the policies that he may put in place. Because of the campaign language that he was using prior to being sworn in, had said that he was considering banning foreign students. So there were universities in the United States who sent out letters to their international students telling them that it is advisable for them to return to US campuses before January 20th, which is, of course, the date of the inauguration. So some of those countries included Iraq, Syria, Iran, Sudan, Libya, Somalia, Yemen, and two that might surprise people, India and China. So we're not quite sure how to interpret this pre-inauguration language. Is President Trump considering banning foreign students, reducing the number of foreign students who will be able to come here? We clearly don't know, but this was of a big enough concern that major universities in the US got in touch with their international students and provided this advice to them.
Wasn't there a travel ban issued by President Trump in his first administration, Elizabeth?
Yes, and that would be, there have been travel bans. Of course, some of them were COVID related, many weren't. But yes, in his first administration, there were travel bans in place. Most of them were focused on majority Muslim countries. India and China were not included in that original group, but now things have changed over the last 4 years, and now India and China are coming under scrutiny. So if you go to the next slide, there's more about the travel ban. So as this slide mentions, there was a 2017 travel ban from 7 Muslim majority countries. He has vowed pre-inauguration to reinstate this travel ban and expand it to include India and China and perhaps other countries as well. So that's certainly a concern. the language around the US-Mexico border, illegal immigration, the importation of fentanyl into the United States, and other issues between the US and Mexico, promise that the next several years, certainly the next 1 to 2 years, will be very stressful, a very stressed relationship between the two countries. As of yesterday, the border wasn't closed. I haven't looked today to see if anything has changed. I haven't seen anything announced, but clearly there's going to be a lot of activity at the US-Mexico border that will discourage travel from either from the US to Mexico or Mexico to the United States for any purpose. And of course, the travel industry is really quite anxious about any travel bans that could come into effect. And this is from the American Society of Travel Agents, the CEO, who wrote to then-elect President Trump saying that travel restrictions create uncertainty, and restrictions, of course, negatively impact the US economy and our ability, the ability of the US to compete for international travel. So, of course, all of this is really important for the medical travel sector, whether people are able to come to the US, to leave the United States, and from a very practical political standpoint, when there's a travel ban issued from one country, there's usually some retaliatory measures that are taken. So let's just say, for example, that there's a 90-day travel ban from Muslim countries and India. And we can't expect that those countries are going to not retaliate in some way by banning US travelers. So it creates a lot of uncertainty, and not just within the borders of the United States, but globally.
Didn't the initial Trump travel ban, as you've cited here, didn't it have a chilling effect on arrivals to the United States overall?
Oh, absolutely. And I have some visitor numbers that I pulled at the last minute here. Yes, during his first administration, when it was announced that he was elected, and even before he took office, visitors to the United States, international visitors to the United States, the numbers dropped. And then, of course, during his administration, we had COVID, so it's very hard to get any reliable data for 2020. So hard to make that comparison, but I've looked at what's happened so far this year and what's been a very contentious period of time in the US. And okay, so in the past 12 months, international visitors to the US hit a high in July of 6.9 million people in the month of July, and that hit a high of 7.5 million people in August. And then in September, that number dropped to 6 million. And in December, it dropped a little bit below 6 million. So looking at pre-COVID numbers from international travelers, it was somewhere between 5 and 5.8 million international visitors per month. So I looked at the projected numbers for 2025, and it looks like for the first 6 months of 2025, those numbers will be on average about 5.5 million. So that's 2 million visitors in 1 month less than the peak in August. So there are a lot of factors that might contribute to that. It's really too soon to tell whether or not this is the Trump effect. Maybe it is, maybe it's not, but we will certainly be looking at those numbers over time.
Great.
So I know this has already been in the news. This process has started of the U.S. withdrawing from its membership from the World Health Organization. So President Trump signed the executive order that begins a one-year process. So it's giving WHO a notice that the U.S. intends to withdraw its membership. Now, President Trump vowed this same item when he was running for office the first time. Obviously, during his first administration, the U.S. did not withdraw from WHO, but this time he has actually signed the executive order. So it's really hard to know if this is a bargaining chip or if the U.S. is really serious about withdrawing from WHO. But for right now, I'm going to assume that the U.S. is serious and that this will happen in about a year's time. What does that mean? So for WHO, it obviously means loss of funding and the loss of support from a key partner. One area that I find very concerning, considering we have just emerged from the COVID-19 pandemic, is that we will not be sharing and will not have access to information to help detect and prevent outbreaks. It also means the loss of help in building stronger health systems. This was a very important part of U.S. foreign policy for a number of years as part of national security and also as part of what's called soft diplomacy. It's in our national interest to have other countries with strong healthcare systems. It keeps people at home, and it's a positive thing for U.S. Businesses, for our pharmaceutical companies, for our medical devices companies. So that's something that we'll have to see how that plays out. Is it an opportunity for WHO to rebuild, to rethink, to innovate? That's a question mark for the leadership of WHO. And during this one-year period, and perhaps after the U.S. withdrawal, who will step into that leadership position? Will it be China? Will it be India? Will it be Saudi Arabia? Could it be another country? We just don't know, but that's what this executive order looks like at this early stage.
And of course, my observation about this is that bugs don't know borders, and failure to coordinate preventive activities and detection activities creates a significant level of risk.
Absolutely, and I think it ties in really into the next slide that you have about vaccines in general.
Right. So Elizabeth has covered some important aspects of the Trump effect, the potential Trump effect. I have to talk about policy, and policy always gets into politics, but what policies have been announced or enacted by the first day executive orders in the Trump administration that have a direct bearing on cross-border trade in medical and health services, aka medical tourism. And what I've done here is created a table. The first item that I put on the list is threats to the Affordable Care Act. There is yet another Supreme Court case in having to do with the Affordable Care Act. And with the leanings of this particular court, it's very likely that this one it's anticipated that this one may succeed. And it has to do with, I won't delve into the weeds. Elizabeth has promised to reel me back in if it all gets too complicated. But health insurance is complicated, right? So this particular case has to do with whether employers should be required to offer coverage for certain benefits. So what this would do is, if the Supreme Court rules in favor of the party that's suing, which is a group of employers, they would be able to carve out or remove certain pieces of their plan coverage, which would allow them, the employers and their insurers, whether they have a reinsurance or self-insured, but it would allow them to cut costs. It would allow them to reduce coverage, control costs, and basically shift costs to the employees, which is a trend that's going on now for many years anyhow. So the effect on inbound medical travel should be neutral, but the effect on outbound medical travel might be positive if indeed coverages are compromised and reduced, eliminated even. Those covered individuals, those individuals who are no longer covered, may be seeking care outside of the United States at a destination that they can access. The second item here in this rogues
Oh,
list. Yes,
excuse me,
sure.
Irving, but before you move on to that, in terms of changes to Obamacare, the practical implications of that for U.S. Individuals is that not only could certain services be carved out, but more costs shifted to them so that the deductibles become higher, their out-of-pocket costs become higher. So for example, if there's a service that had been covered that's no longer covered by an employer, that employee may do some calculations and say, well, okay, now I have to pay for this out of pocket. How much is that going to cost? And should I start looking around for more affordable alternatives? And that may include outbound medical travel.
Yes, it may, and we should recall, and I think many of our listeners will recall, that before the Affordable Care Act or Obamacare was passed in 2010, in 2008, 2009, 50%, almost 50% of the American population had no health insurance. And the theory at the time was that the lack of coverage for desired or required services would drive American consumers to seek medical care elsewhere. Costa Rica, Mexico, places where Americans could see themselves or get to. And to some significant degree, that did not materialize. It did a little bit, but not a lot. Now, maybe that experience was a way of alerting American markets, American consumers, that indeed there are other options out there. So maybe that precursor was enough to push medical tourism across the adoption gap, as they say. I'm not really sure. We'll have to wait and see. And I'm only into number one of what is yes. At least 6, and I've already carved one out. So there are a number of factors here that will have some levels of impact. The next one in the list, which is extraordinarily important and mustn't be discounted by anyone anywhere, is the anti-vaccine public health risks introduced by the administration in the appointment of RFK Jr., Robert F. Kennedy Jr., as the Secretary of Health and Human Services.
At this point, he's a nominee and has not been confirmed, but
Correct.
Yes, he has been put forth.
Correct. So there are certain, without getting into the weeds, there are certain individuals that require Senate confirmation, and this nomination requires Senate confirmation. So the important thing here is, once again, bugs know no borders, and anti-vax is all over Robert F. Kennedy Jr.'s history, his public stated positions, and his initial assistants are all what they call anti-vaxxers. Now, regardless of what your politics are about vaccine, I never thought I'd use those two words in the same sentence, politics and vaccines, but there it is. Regardless of what you think of that, there are public health consequences to this that will reverberate within the United States and to those who travel to and from the United States. It's plausible that individuals who travel from the United States, which deploys a significant policy about vaccine denial and vaccine suppression, let's just call it, it's very possible that there could be discriminatory bans in certain destination locations to individuals who have not or don't evidence a history of vaccines. We saw some of this during COVID and we all adapted to it. I still have my vaccination card tucked into my US passport. So we just don't know what effect this is going to have. I doubt that a dominant political and consumer-based conversation about no vaccines, vaccines are bad, and restrictions in public health through the termination of thousands of people that serve public health roles in the United States, which have already begun. These terminations have already started. I doubt that that's going to make the United States look like a safe destination from foreigners' perspective with regards to health and contagion. So these are indeed issues which I think will have a depressing effect on the attractiveness of the United States as a destination, but could indeed have a positive effect on individuals exiting the United States to seek care elsewhere. The other factor that I've identified here that's very clear and operating in the background, and aside from a few wonks like me, nobody's really talking about, and that's that the policies that have been promulgated and deployed and are in evidence in the initial 100 executive orders issued by the president on his first day, the costs of running a hospital and a medical practice have just gone up. And there's really no way to avoid that. And based on some other things that could happen that I'll talk about in my next slide, these costs might go up a moderate amount. It won't go up a little, it'll go up a moderate amount, or it may go up substantially. So what this means is that higher costs for operating a hospital and delivering secondary, tertiary, or quaternary care, so hospital-based care, these costs are going to go up. And what that means is that American hospitals, which are already the most expensive in the world, will have to charge more in order to cover their costs. And that's going to have a suppressing effect on consumers coming into the United States, except for high net worth individuals. These increased costs for providers are going to also have to be paid and shared among United States patients. So again, these increased costs could have a positive effect on having American consumers seek care outside the United States. The fourth item I want to talk about is reproductive health care. And almost regardless of what you think about this on a moral or ethical basis, the fact that there have now been state-based laws enacted which criminalize the provision of some forms of maternal health care, this is having a chilling effect on Americans seeking reproductive health services in the United States. The evidence is beginning to roll in that these chilling effects are quite clear and broad. So this will have a decreasing effect. Any individuals or families or individuals who were thinking about seeking reproductive health care in the United States, I believe that these laws and the rhetoric, just the language around it, will have a chilling effect on that. And for those individuals, couples or individuals who are seeking reproductive care, reproductive health, I believe that this could indeed and will indeed have the effect of having them look elsewhere for those services.
Okay.
And then in summary, the bottom one here is greater cost shifting to employers and insurers. So Elizabeth mentioned a little bit about this. Healthcare in the United States is 2 times the next closest country. It's 2x it's 2 times more expensive than than other advanced economies, and it's just getting more and more expensive for employers who deliver 50% of the healthcare is covered by employer-based insurance. And it's getting more expensive for employers and insurers, so they are shifting those costs to consumers. Warren Buffett has referred to the American healthcare system as a tapeworm on the economy, and I agree with him. And that tapeworm is just getting more and more hungry. So I see coming down the road I see an either or proposition regarding the economy. So we've talked about policy. We had to talk about politics a little bit. I want to talk about the economy ever so briefly. So right now, the United States is enjoying the strongest status of the United States dollar against other currencies ever. And there's good reason for that. And in geopolitical terms, when things get difficult around the world, money wants to be invested in the United States, and the primary vehicle for that is the United States dollar. So I see 2 potential scenarios in the impacts of the policies being promulgated by Donald Trump and his associates, the administration. So either the United States dollar stays strong with comparatively high dollar value and incremental higher prices, which means that the costs for the US complex care, especially the high level care, surgical care, and complex treatments like cancer treatments and neurology, et cetera, these are going to become more prohibitively expensive, except for high net worth individuals. And then also in this mix, you have RFK, that's Robert F. Kennedy Jr. If he is approved by the Senate and becomes the Secretary of HHS, he has promised to do some things which may reduce internal government costs and bureaucracy, but will have the net effect of increasing costs to providers and therefore driving up costs of care provision. Either that will happen.
We're getting short on time, Irving.
Yep, thank you. Either that will happen, or Trump's policies and rhetoric crash the dollar. So the tariffs and the economic draconian measures he's talked about could lower the value of the United States dollar against world currencies, which would make American healthcare less prohibitively expensive in comparison and may help in general. In addition, this could drive the United States economy into recession. And what we know that in a recession, Americans consume less healthcare, and that could make capacity available among US hospitals, which would spur them on to seek foreign consumers to help fill in that capacity. So I've drawn a bit of a handy chart here, if I can get to it. Strong dollar versus weak dollar, happy face, sad face. I'll leave this for you to look at in the deck when you get it afterwards. So healthcare insurance, there's all the signals that shifts of cost are going to go downhill to the consumer, to the covered individual, and this indeed could augur very well for individuals in the United States seeking medical care outside the United States. So, so let's talk about a chilling effect and what this could mean. Elizabeth?
Thank you, Irving. Yes, so we're going to share some of our best educated guesses. And you can see our crystal ball there is really quite foggy. But we think that these policies that we've discussed, and there are other policies that we just couldn't get to. I mean, we could do a full day seminar on this topic. That these policies have a chilling effect. In other words, it deters people from coming to the United States for any purpose, including healthcare. So that's why we'll look at the tourism numbers. They're a pretty good indicator for people coming to the US for medical care. And if people globally are experiencing this chilling effect, not just Americans, but people around the world, if they do not find the US a welcoming destination for healthcare, that means that those of you in other destinations have an advantage to promote your markets to a wider audience that maybe you thought that they always went to the United States. Well, maybe some of those people who always went to the United States aren't going to be coming here any longer, and that might open up some opportunities for you. At the next slide, please. So I don't think we're going out on a limb here to say that we expect the next 4 years will be chaotic, uncertain, somewhat unpredictable, but we do know that overall, that the policies that are being put into place will make the United States more expensive, including healthcare. So we didn't even touch on the topic of tariffs, but the candidate Trump, now President Trump, has threatened tariffs against our two neighbors, our Canadian neighbors, our Mexican neighbors. We get a staggering amount of food from Mexico, and all of a sudden, if there's a 25% tariff on food, that means that food prices are going to go up. We will have to wait to see what happens in that terms, but just in focusing US healthcare, it's clear that healthcare is going to get more expensive because more costs are going to be shifted to individuals, either those who are insured through self-insured plans or by insurance companies. They're going to face higher out-of-pocket costs, higher deductibles, with fewer services covered by insurance. So that means people have less disposable income here. They're going to be shopping for bargains, especially for healthcare. And what we saw during the pandemic, when there was little or no access to healthcare services, people were not going for treatment. They couldn't go, they weren't going, they were skipping treatments, and they were showing up sicker at the emergency rooms. The next slide, please. So what does this mean for you, for those of us looking for US patients? I think that what has changed from what Irving referenced before in 2008 and 2009, when we thought there would be a bigger uptick in medical tourism, and it didn't really materialize, only to a small extent. A lot has changed in the last 15 years, and I think people's awareness globally of cross-border healthcare services is much more accepted than it was 15 years ago, which for me, Irving's a born and bred optimist. I'm a realist, and I'm saying I think that there are now opportunities that were not there 15 years ago. So hopefully that's good news for some people. It's not really great news for US healthcare patients, but this is the way the world is going. So there are more opportunities. Finding those US patients who are able and willing to travel outside the US for healthcare remains a challenge. It's a big country. People are widely dispersed. It's not like Canada where there's a smaller number of people, but they are in metropolitan areas. So you need an excellent strategic plan. You need really good market research and a good marketing plan. We are also seeing in the work that we've done that there are international insurance companies, not US-based insurance companies, but international insurance companies that are offering policies to people outside the US that exclude US healthcare. So for example, if I'm a well-paid CEO at a company in Mexico and I have international insurance company coverage, that my policy may say, we will send you and your family members anywhere in the world except the United States. And we are seeing an increase in this because the US is starting to outprice itself of the market.
And what's interesting is that there's all kinds of euphemisms cropping up for how the insurance companies talk about this. Utilization review, preferred access. There's all kinds of language about it, but basically what they're doing is they're steering consumers away from a higher price destination, which in the globe is the United States.
Have one more slide? Oh,
Yep.
yes, we do. Yes, so self-insured employers, we haven't really talked about them very much. It's another complicated topic for those of you who are not familiar with it. But these self-insured employers have offered international options for years. And historically, few employees have chosen the international option. Maybe it is time for that to change. It certainly is possible, and we will see. We'll just have to see how that goes. So our final words of advice for you, strategic plans, they need to be resilient. They need to be updated regularly, not once a year or every 5 years, whatever you used to do. They now have to include new risk management assessments based on global geopolitical and economic factors. Those were hardly ever in any healthcare provider's strategic plan. And now we are seeing that not only are clients coming and asking us for these specialized services, but we anticipated and have been advising our clients in this direction for the past several years. But I think now it is clear that strategic plans must include politics and economics.
Yeah, and general geopolitical risks. And there are public access information that anybody can grab hold of for free. I think Eurasia, the Global Risk Index, there are things that you can look at that incorporate many of these elements. And what Elizabeth is suggesting is that if you're in an IPS, an International Patient Services Department in a hospital, it's time to look at these risk factors and add them to your strategic plan. So
Great.
Let's see if we have questions.
We have a number of questions, so we can try to move through them as best we can. Okay, first, I noticed that on the USA Jobs website that 0 jobs are open in HHS. Is it a hiring freeze? And if so, what does that mean for US global health policy and practice?
Can I? So yes,
go ahead, Irving.
that's absolutely. It was one of the executive orders was to freeze all hiring. So it's the baby in the bathwater thing. When you do something like that, it's a very broad brush stroke, and that's what now President Trump campaigned on these very sweeping changes, and that's what he's put into place. How does that augur? I would, from my point of view, it does not augur well because it's extremely difficult to stop and start that kind of engine, that kind of hiring drive, because the stream of prospective candidates, they go somewhere else. And once they go somewhere else, you've either got to try to attract them back or reinitiate the stream that's coming to you. And Elizabeth didn't get to this, but maybe she'll share with you an interesting factoid that she discovered about nursing visas in the United States.
Yes, so for the past year, there's been a freeze on processing visa applications for international nurses. So that has created a backlog of more than 10,000 applications for international nurses. And this is a political battle that's going on in the United States between certain professional organizations that want to protect the profession and other healthcare providers who are struggling filling vacancies. So that's just one small example of what can happen when the government says, well, we're not going to do this anymore. And in terms of the hiring freeze, I think that's just going to create so much chaos for so many projects that are ongoing within healthcare, within international public health, and other sectors, obviously. And this is just part of the plan for what I would call the politicization. And it's not just me. This is Irving and I read a lot of research. We read a lot of different opinions from the liberal side to the extremely conservative side. And this is the politicization of agencies within the United States government to align with the Trump agenda. So I think this is going to have some far-reaching implications that even the Trump administration has not anticipated. So that Irving talked about recession, we've got this strong dollar, the stock market's going crazy. And so everybody's assuming that things are going to continue in that direction. And I think we could be in for some serious shocks.
Great, thank you. But with the new policies, the outbound won't be limited by the same policies. Won't the U.S. government try to maintain patients in the U.S. by any means?
Not at all. The United States government has no interest in who goes where for what. There's been no research, no coordination to date. The only, and Elizabeth and I were talking about this just recently. We wrote an article called Looking Around the Corner back in 2020, predicting the course of cross-border trade in medical services for the United States. And the author of that report received a grant from the United States Department of Commerce to look at that just the issue that the questioner asked about, are Americans going elsewhere for care, and what foreigners are coming into the United States for care. As far as I know, that's the only government-funded research that's ever occurred in these markets for cross-border trade and medical services. So no, the United States has no interest in it. Individual providers do. And if there's a cross-border war between cross-border frictions between the United States and Mexico, certainly the Texas-based medical providers that rely on a stream of consumers coming across the border to receive care and to return to Mexico, certainly they care, but there's no interest at a governmental level on those issues.
And there's almost a perverse inverse that if a U.S. patient goes somewhere else, that's one less patient that has to be paid for either by an insurance company. They'd be happy to not pay for your medical care, or government plans like Medicare. They'd be happy to not have to pay your medical bill. So
I don't know if that's true. I don't know if that's true, but it's an interesting thought.
Okay, thank you. With the dollar expected to strengthen, do you see this driving more Americans to seek medical care abroad? And if so, how might the healthcare industry respond to protect its domestic market?
Wow. You want to start, Elizabeth?
Well, I'll start with the second part first. I don't know how much maneuverability, excuse me, U.S. providers have to protect their international client base. They can only, they still have to make money with what they charge. So with U.S. healthcare already, more than 2 times more expensive than the next most expensive healthcare, they have to, that number is just going to go up. It's just going to continue to get more and more expensive. So they can't do it by reducing prices. So all they can do is to continue to innovate and offer clinical care that can't be found elsewhere. But on the other hand, we have a pending shakeup at Health and Human Services. We're really unclear about the impact that that's going to have on innovation in the United States. I think people who are serious scientists are going to be leaving the government in droves and maybe looking for positions elsewhere. So I really think U.S. hospitals are in a very tight position.
I completely agree with Elizabeth. And in marketing overall, an old saw is that there's 5 P's of marketing: product, placement, promotion, price, and position. So hospitals have no very, very little, minuscule maneuverability on price, in part because virtually all the hospitals in the United States engage with CMS, so the Centers for Medicare and Medicaid Services, as their payor. And there's very strict rules about how hospitals charge for things. And there are floors, not ceilings, but floors as to what they can charge. So they can't go below the floor without threatening what they are able to charge for through other intermediaries, through CMS, through government contracts, et cetera. So no, I agree with Elizabeth. I don't think there's any maneuverability there for US hospitals to compete on price. They simply cannot.
We have a few people asking about international healthcare coverage companies for US citizens.
So we've had some conversations with international insurance companies. They've been our clients, and we've had other conversations with them about creating packages that would offer coverage for American consumers in foreign destinations. And the problem to date is that there isn't enough individuals pooled together to be able to create a risk model that insurance companies are comfortable with. Insurance companies are all about risk. They are risk managers, and they profit when the premiums they collect are less than the cost that they pay out. In fact, that's the key metric in an insurance company: medical loss ratios, they call it, MLRs. So we've talked with that, and the issue is scale. So maybe what will happen this is wild speculation now, but maybe what will happen is that there could be enough individuals who are income qualified, who don't have proper insurance, who will want to seek medical care elsewhere to get the attention of some international carriers, who will then begin to draft plans that will meet that need. Elizabeth and I have talked to some of those entities, and those conversations could heat up as the reality of the Trump effect begins to click into gear.
Yeah, in short, several people, several entities have tried to create this package, and
Right.
it simply has not succeeded so far. But maybe things will change. But yes, as Irving said, there's not enough big enough pool of people who would actually purchase this product. So if there's not money to be made, insurance companies aren't going to offer it, obviously.
Great. We have a number of questions. I'm afraid we're not going to get to everything, so we will make sure to follow up with these questions. What are the key reasons for self-funded employees to not choose international options?
What a great question. And it's great because we are probably the only people who've really researched that in any sort of rigorous and scientific way. And the bottom line, the qualitative reason why employees in a self-insured environment who have access to an international plan, if they can't access that destination in their mind's eye, even though it will cost them less, it will be convenient, they know somebody who did it and it worked out for them, okay, they will not do it. So the issue I have written about, and Elizabeth and I have talked about and worked with clients about, is the psychological dimension of access, not physical access, but access. And the analogy I like to use is that if I say to Emily, let's go get a cup of coffee, immediately Emily can think of a place where we could go and sit and have a cup of coffee. If you talk about, well, let's go have a hip replacement, if you can't access or envision yourself having that hip replacement in that destination, you're not going to do it.
There are all sorts of factors that go into making that decision about healthcare. It certainly depends on why you're traveling. How complex is the procedure? The less complex, perhaps, the more willing people would be to travel for it. It's the fear of being away from home. It's the fear of something going wrong. It's the time away. So if I decide I'm going to travel somewhere for some kind of procedure, it might be fine for me, but then what about my husband? So now my husband's going to come with me, and that if he can't work remotely, that means missing work or taking vacation days. So there are family issues, security issues. And, we'll go back to where we started. How do I get a passport? And applying for a passport a year ago, let's see, it was about a year ago, I needed to replace my US passport. Right. It was an 8-month wait. And for someone like me who travels, it was particularly convenient to wait that long for a passport. So it could be everything from some logistical issues to family issues to the severity of the services that are needed, to just plain old, it's just easier to stay here and have the treatment here.
Okay, I think we can do one more, although this is a big question. If more U.S. patients seek medical care abroad and the U.S. is not attracting international patients to offset this, could we reach a point where rising healthcare costs here become unsustainable? I'm not trying to exaggerate, but could this lead us toward a doomsday scenario for U.S. healthcare?
Go ahead, Elizabeth.
Yes.
And I would concur. I would concur.
Yes, it's completely unsustainable to be on the trajectory that we're heading.
It is.
And Irving and I have talked about this. We've had conversations with other people about it, but we just don't see a way to stop this spiral of increasing costs. And now with a president who's all about doing business and maximizing profits, when you're talking about healthcare and you're maximizing profits, that means that there are a lot of patients who are not going to get treatment. And at some point, the American people are going to get sick and tired of it. I mean, we haven't even discussed the horrible incident of the CEO of United Healthcare being murdered on the streets of New York. I think that individual is just representative of the frustration and anger that people feel about the US healthcare system and how it is failing people terribly. And I hate to even call it a healthcare system. It's not caring about my health. It is fixing whatever has gone wrong because there wasn't prevention or some other issue. But yes, I think and I'm a realist, Irving's the optimist. So if he thinks that that's the trajectory, then things are bad.
Yep. It's a slow motion train wreck.